Hey guys, it's Dr. John Giuseppe again from San Clemente, California, and in today's video, I'm going to be discussing the topic of complete dentures, also referred to as full dentures. These guys right here. Okay, this is a complete upper denture. This is a complete lower denture or full denture. So I'm going to be going in detail and discussing everything you need to know about complete dentures or full dentures. If you want to learn about other kinds of dentures, I have other videos. You can find those in the description below. But in today's video, we're going to be going over what are complete dentures, what are full dentures. I'll go over the procedure of how you make complete dentures. So if you have an appointment coming up to make a set of complete dentures, this is going to help you, show you what to expect during treatment. Afterwards, I will discuss the pros and cons of complete dentures in contrast to other options for replacing your teeth if you have none left. I'll go over the typical cost of what complete dentures go for in the United States, as well as insurance coverage for them. And then finally, like all my other videos, I'll share with you my personal thoughts on what I feel like about complete dentures and whether or not you should get them for your mouth or not. By the end of this video, you'll have a clear understanding of what complete dentures are to kind of give you an idea if that's something that's going to work for you or not. Okay, guys. Now, before I start my thorough discussion of complete dentures, I want to bring your attention to the website even28.com. If you don't have a dentist and you're looking for one, whether it's for dentures or anything else, go to the website. That's EVEN, the number 2, the number 8.com, like the 28 teeth in your mouth. Even 28 is a dentist search engine. You can browse through profiles of dentists in your area based on zip code, based on city, read their reviews, see what services they offer, their office hours. And when you find a dentist that you like, you can schedule your appointment conveniently online from the website even28.com, the dentist search engine, and it's free to use. So guys, go and find your dentist, get that mouth fixed. I'll see you guys there. So what is a complete denture? A complete denture is a denture that replaces all of the teeth in the respective arch. So if we're talking about a complete denture, which again, full dentures, their terms are both used interchangeably. A complete denture is for the upper, replaces all of your upper teeth, okay? So this would be an example of a complete upper denture. That's the portion that sits inside of the jaw. So you have to have no more teeth left inside of your mouth, right? All your teeth have to come out in order to get a complete denture. If you have even one tooth left, you're not getting a complete denture. That's called a partial denture, which you can learn more about in my other videos. Complete dentures, all the teeth are gone. So that would be a complete upper denture. And this would be a complete lower denture, right? Which replaces all of the lower teeth. These two dentures have 14 teeth, so a total of 28. But sometimes if your mouth is smaller, the dentist might put 12 instead of 14, or occasionally put 16, although that's very rare. So it gives you a full set of teeth back, regardless of how many teeth is involved there. Now, if you've been paying attention, you notice there's two parts to a complete denture. There's a pink part, which is the bulk of it, right? All of that. And then there's the white part. The pink part replaces your missing gum tissue, and it also provides for suction. So what happens is when you put this in the mouth, the grip that it gets, the suction, is provided by the pink portion, the pink acrylic portion of the complete denture. That's what gives it the stability to stay inside of your mouth. The white part are the actual teeth themselves. So that's the replacement to the teeth. And as you notice, they look like teeth. You know, they're usually made from acrylic, although you can ask for more expensive material too, but they're all pretty much the same, more or less. Okay, so that's what complete dentures look like. And again, the same thing applies to the lower ones. You would have the pink portion, which is made to fit your lower jaw, and then the teeth, which replace your missing teeth. Now, with a complete denture, there's some getting used to it, because obviously they're not your own teeth anymore. And you only have about 30 to 60% chewing efficiency with them. So you're not going to be able to crack into a nut or, you know, buy popcorns. But some denture wearers do really well with them, some not as well. So you never know exactly which one you're going to fall into, if you're going to be one of those denture wearing superstars or if you're going to struggle with them or hate them. But there's a variation. Some people do really well with them, some people don't. And there are a lot of factors that determine how well you do with dentures, such as the quality of your jawbone, how big your jawbone is, the size of your jaw. The bigger your jaw is, the better. The quality of the gum tissue. If you have nice, firm, keratinized gum tissue versus thin, fragile gum tissue, it's going to be a huge difference. And there's just a whole bunch of other factors, musculature control, a lot of different things. So some people do really well with them, some people struggle with them, and some people can't wear them. So you can learn more about different options in addition to full dentures to replace all of your teeth in my other videos. But for now, we're gonna just focus on full dentures. So that's how full dentures are. Now let's go ahead and kind of discuss how we make them and the procedure of making dentures in the next section. We're going to discuss the procedure of how complete dentures, full dentures, are fabricated. So in order to make this denture, there's 4 steps more or less involved. The first step is to take an impression. And the way we do this is by using trays, okay? So this would be an upper tray. Okay, some dentists use metal, some people use plastic. That's for the top ones, which includes the roof of the mouth. And these are the impression trays for the lower ones. Again, metal or plastic, and they come in different sizes. This is a large one. I have small, medium, extra large. You name it, I have it. Okay, so we make some putty or putty-like material, and we take an impression of your teeth in order to get the impression. If the impression isn't very accurate, we could make custom trays and then take a second set of impression. But once the impressions are done and they're poured up, then you're gonna have a replica of the jaw, which is gonna look like this. Okay, so the impression is taken, the lab pours it up, and then they have a stone model, so the lab knows what your jaw looks like. That's step number 1, is the impression. Step number 2 is the wax rim, and this is what the wax rim looks like. Okay, and we use the wax rim to determine the position of the teeth. So if this would be a lower wax rim, I would kind of bite into it, and then the lab, I would kind of mark where the middle goes. I would draw the smile line, maybe indicate where the canines are. So I put some markings, I pick a tooth color, and I send it to the laboratory, and the lab actually sets the teeth on it. That's step 2, the wax rim, which is the measurement step and the step where you choose the color. On step 3, the teeth are actually going to be set inside of the wax for a try-in. So imagine these teeth set inside of the wax. This is called step 3, which is the denture try-in step. At this point, the teeth are still in wax. So if you don't like the color, I can have the lab make them lighter or whiter. If you don't like the size of the teeth, I can instruct my lab technician to make the teeth wider, smaller, whiter, yellower. You tell me what you want to change and I'll do it. I also make sure that the teeth position are up to my expectations in terms of speech, where they position your lip. So if I feel that pushing your lip out too much, I might request the lab to bring them back in. In contrast to that, if they're too sunken in, I might push them out. There's a lot of things we look at in order to create the proper denture. You know, we want to have a really well-balanced occlusion where the teeth are all touching each other and the bite forces are spread. So we look at a lot of different things, and that's the teeth trying, where again, the dentist makes sure that the teeth position are where they should be, and the patient makes sure they like the color, shape, and the position of the teeth. Okay, step number 3. Once everything's been accepted by the patient and the dentist, which again, this can take several visits because it may go back and forth to the lab until you're both happy, you and your dentist. Then the denture is processed and you get your dentures, okay? So they're finished, they're made from the acrylic, and you can actually start wearing them, okay? So that's the delivery appointment, is the step number 4. Impression, wax rims, denture try-in or teeth try-in, and the denture delivery. Now, you're not done necessarily. You still have to come back for adjustments, because as you wear your dentures, you're gonna find that they're gonna be cutting you, causing sore lesions, and damaging your gums potentially. The bite might be up. So what you do is you go to your dentist, you say, you know, doctor, I'm having pain here, and it's hurting me here, and the doctor does adjustments. Usually, most of my complete dentures come in for about 3 to 5 adjustments, which is actually quite a bit, but because we're replacing all of the teeth, there usually is a lot of adjustments required, because don't forget, these dentures are not actually anchored to anything and they're quite wobbly. So it does take some adjustments, and it does take some getting used to. So if it's your first time wearing dentures, allow yourself a couple months to get comfortable with them. You might want to use denture glues in the interim as you're getting used to it. I usually compare that to training wheels on bicycles, right? When you're riding a bicycle at first, you want to put the training wheels to get good at them. And again, the same thing is applied with dentures. You always put some denture glue on the inside, Fixodent and Polygrip are the most two common brands. Apply some of the glue, kind of let them stay in your mouth until you get more comfortable with them. And then you may or may not need it going forward, but for first-time denture wearers, it's always beneficial to start off with. But yeah, the denture adjustment should also be included. So how long does it take? I would say there are labs that do it in one day. They have their own technician. They do all the 3-4 steps together. You walk there in the morning without a teeth and you walk out there the nighttime or the next day and you have your teeth. Those are rare. Most dentists see you on a weekly, bi-weekly basis. So they take 1 to 2 months to make the dentures. That's just how we work usually because we have to communicate it to the lab back and forth. Outside of the United States, there's a specialist called the Dentures, and these are people who just make dentures, so they make them in one day. But in the United States, the dentist has to make it, which is why it usually takes about a month or 2 to make him, and again, another month or 2 to get used to them. So allow yourself sufficient time for your dentist to be able to do all these steps. Because if they rush every step, or if they make one mistake, if the impression is not very accurate, or if the teeth color aren't what you want them to be, or the position is off, a lot of times you have to redo the whole thing from scratch. So it just is a time-consuming process, but you're getting all of your teeth. So you just got to allow us the time in order to make you a denture that you're going to love and be able to use for a long time to come. Okay, the advantages and disadvantages of complete dentures. Okay. Well, the most obvious advantage of a denture is it gives you your teeth back. Yay, you know, you want teeth, you don't have any teeth, you get a set of dentures, you're good to go. Dentures are very common. A lot of people have them who have no teeth. A quarter of people in the United States over the age of 65 are completely toothless. And the majority of them wear dentures. I mean, that's just what you do when you have no teeth. You know, you start off with dentures, and then if the dentures aren't working out, you can get into other options, but denture is a very easy option to replace all of your teeth. Plus, when you get dentures, you're done with the dentist. There's no more teeth left. You know, a lot of times patients kind of try to save 1 or 2 teeth in their mouth in order to anchor the dentures. Once you go to a full denture, complete dentures, there's no more teeth left. So there's no more dental appointments, there's no more needles, there's no more dental cleanings, no more x-rays for diagnosing cavities. You're done with all that. So it's a very finite, final treatment, and patients like that about it because a lot of people who end up in complete dentures have been struggling going to the dentist, struggling with their teeth. So to get rid of all those teeth and the infection, the broken teeth, and to actually have something that doesn't require constant maintenance, something that they haven't really succeeded at, is a blessing to most of them. So you're done with the dentist, you're done with needles, you're done with checkups, cleanings. Awesome. That's another advantage of complete dentures. And then, of course, they're easy, they're affordable, and they're just are, you know, very easy to get them. Just usually takes a couple weeks, couple months, and they cost a lot less, especially when you start comparing them to implant. It's just a fraction of the price. I'll be discussing the cost of full dentures later in the video. But if you have no teeth, this is your least expensive option, is a set of full dentures to replace all of your teeth, for sure. Okay, so those are the advantages of having full dentures. What are the disadvantages? Well, the disadvantages, full dentures work for some patients, but not for all patients. There's patients who like their dentures, they eat pretty comfortable with them, almost every single food. Then there's patients who struggle with them. They have sore lesions and have to get multiple adjustments. And then there's ones that just never actually are able to wear the denture. So the denture sits in a cupboard. They sometimes go get a second pair of dentures or get multiple adjustments. And at some point they just give up. I'm just not gonna wear my dentures. Maybe they wear one set, not the other, but they find themselves miserable, hating the dentures. And for those people, they need to consider options of implants in addition to dentures or instead of dentures. And I have videos that discuss those. You want to look at implant supported dentures, all on 4 teeth, or full map dental implants. Those are your 3 options if you're toothless. But you know, again, it just doesn't work for everybody. Some people do great with them, some people not so much. That's one of the main disadvantages of dentures. Another disadvantage is they break and they wear over time. So these teeth are made from acrylic, the denture teeth. And as you chew on them and you're biting your food, I dropped it. That's another risk of dentures, which I'm going to get to. As you chew on them, the teeth wear thin. So denture wearers who've been wearing dentures for 3-5 years, their teeth get really flat. And that's just what happens. If you have dentures opposing natural teeth, they get flat at a much accelerated rate. So if you have a couple teeth here and nothing on top, it really damages the denture. It also increases the chances of them breaking. You saw me drop the dentures. If you do that, the denture breaks. And usually when a denture breaks, you can't really repair it. If it breaks in half, they can put a mesh in there, but usually you have to get a brand new set. So you want to be very careful not to drop the denture. That's one of the other disadvantages, which we came upon in this video too, right? But yeah, they just are, you know, it's a little plastic prosthesis and they're very vulnerable. So that's one of the disadvantages. And the last disadvantage of dentures, as compared to like full implants and stuff, is dentures does nothing to prevent your cheeks and your jawbone and your face from shrinking and resorbing. So when you're wearing full dentures, you're gonna develop wrinkles, your jawbone's gonna shrink, your mouth's gonna become smaller, and that's just something that happens. So when you have no teeth and no implants, your jawbone shrinks at about 3 times the pace of, in contrast to when you have teeth. So your face really starts to sink in, and wearing dentures can actually kind of like the pink part, make it pushed out, but it doesn't prevent your face from wrinkling. It doesn't prevent your jawbone from shrinking. So that's another disadvantage of the dentures is there's just no comparison to natural teeth when it comes to cosmetics. And maintaining your facial structure over time. Okay, so those are the pros and cons of dentures. Again, they're very popular. I don't want to knock dentures. They're just not as good as implants. But for people who can't afford them, they're a fantastic option and a great replacement to their teeth in contrast to being toothless. How much do dentures cost? I want to say the average cost of dentures in the United States is about $1,000 to $2,000 per denture. So this one or this one, that's the average cost. Low-end costs, if you go to like the cheapest places, you might be looking at $500, $600, $700. Because don't forget, your dentist has to pay the lab bill too, which is usually a few $100s. So at $500, $600, I mean, your dentist is making almost nothing. But that would be the cheapest. And then the more expensive places, a few $1,000s per denture. Dentures usually never get super expensive because if somebody's going to spend $10,000, well, they're going to look into the option of dental implants. So denture prices are usually for maybe a set anywhere from $2,000 to $4,000, $5,000. It's about what the average cost is in the United States. Now, the good news is having dental insurance is very helpful. Most insurances cover dentures, a portion of it or all of it, or some of it at least, hopefully. Why? Because insurances love paying for things that are A, cheap, and B, like the final treatment. So when they pay for your dentures, they're not paying for cleanings, exams, checkups, you're done, right? That's the last check the insurance company writes on your behalf. Great, insurance company loves it. So they usually cover full dentures without a question. In fact, there's a lot of cases where the patient comes in and they have 4 or 5 teeth left and the insurance company says, I'm only approving full dentures because I want those 4 or 5 teeth out. They're willing to pay for those 4 or 5 extra extractions in order to put you in a full denture. So you don't need cleaning, checkups, exams, fillings, etc., etc. So regardless, insurances are almost always helpful with dentures. Now, of course, you want to check with your specific insurance company and your dentist and whatnot. And don't forget, there's insurance limits. So if they pay for a denture, you're not getting a new one for 3, 5, or even 8 years now, I've heard of. So that might, that's something you need to consider is, you know, you have to take care of a denture. And if it breaks before that time period, the cost is totally on you. Regardless, insurance, usually helpful. And again, it's something that's not really that expensive to begin with. But yeah, that's cost of the dentures. And when you look at it, like when you compare them to an implant, typically a single implant costs as much as a full set of dentures, upper and lower, right? Because one implant average cost in the United States is $4,000 to $5,000. That's what a full set of dentures cost. So you can actually replace all of your teeth with dentures for about the same cost, or maybe even less than one single dental implant, one single missing tooth. Basically, long story short, dentures are affordable. So if you're toothless or about to become one, this is something to consider if you're looking for the least expensive, most convenient option of replacing your teeth. And if it works out, then great, you're done. You don't need to do anything else. If it doesn't, then look into my other videos, which discuss implant-supported dentures, all for a full mouth implants, to understand about your other options when it comes to replacing your teeth. I'll put a description to those in the below in the description box so you can learn more about it. Okay, guys, so that's the typical cost of dentures. They're just not that expensive. Let's go ahead and share with you my final thoughts on what I feel like about dentures. Okay, so guys, there's a lot of people that are going to lose their teeth in their lifetime. Like I said, a quarter of people over 65 are toothless in the United States, and we're a developed country, right? So in other countries, a lot of people, by the time they get older, senior citizen, they're done. All of their teeth fall out of their mouth. Now, we're not going to get into the reasons of that, bad teeth, diabetes, smoking, dental neglect. There's a whole bunch of stuff that causes you to lose your teeth. But when you lose your teeth, you need something to replace it. And dentures are the most affordable way to replace them. So a lot of people go for that. Now, do dentures work? For a lot of people, they do. I mean, there's a lot of people that wear dentures and they're happy with them. My dad, he's been wearing dentures for decades. I've told him, come get implants, now that I'm a dentist, and do implants. He doesn't want to do it because he can eat everything with his dentures. He's comfortable with them. He speaks fine with them. Yeah, I mean, the teeth get old, they get stained, but that happens with everything, right? But he has a really good jawbone. He's very comfortable because he's been wearing them for a long time. He has a really nice, well-made set of dentures. He takes good care of it. And he has very thick jawbone, very good gum structure, and he does really well with his dentures, okay? So that's him. And then there's people that have really tiny jawbones, really fragile gums, and they suffer with dentures. And those are the people that come to me and spend tens of thousands of dollars getting dental implants because they don't want to wear dentures. Okay, so which category you're going to fall into? You probably won't know. There's a good chance your dentist can't really tell either because we never know where your jawbone's going to settle, how much gum you're going to have if you currently have teeth in your mouth and you're about to become a denture wearer. So you just got to make your dentures and see how it goes. If you do great, awesome, fantastic, good for you. But if you're struggling with them, then you need to look into the option of implants. And that starts with maybe putting a couple implants to anchor the dentures. That's called snap-on dentures. Or getting permanent teeth, which is all on 4 teeth or full mouth dental implants. I have videos that explain those. I'll put them in the description box below so you can learn more about them. But like I said, what you get for dentures in terms of the value and the cost and the money is great for a lot of people because that's all it takes for people to replace their mouth with some dentures and they're happy, they're good to go. If you have infected teeth in your mouth, broken teeth, root tips, you have just tartar everywhere, your teeth are loose, you've been smoking a long time and you have really bad gum disease, you're better off taking out your teeth and wearing dentures because leaving infected, broken, damaged, loose teeth in your mouth causes the infection to spread to your whole mouth. So I've had patients in their 30s, 40s get dentures, which may seem young, but because they had such bad teeth, they tell me, Doc, I was so relieved when I got my dentures or when you made my dentures because I got rid of the infection and it just feels so much better. So dentures and no teeth is better than infected, broken teeth every single time. Okay, so if that's you, try it. Take out your teeth, get the dentures. Of course, you have to discuss with your dentist and see if that applies to you. But if you have terminal gum disease or if you have so much cavities and such bad teeth that it's just impossible to maintain them, dentures is the most affordable way. And having your body rid of that infection is always worth it. Now, if you get the dentures and you don't like it, luckily there's options, not cheap ones, but there's options. You can put a couple implants to anchor them. That's the most simple one. Or you can go for the all-outs, the permanent replacement options. But, teeth are part of your body, and having an infected teeth isn't any different than having an infected finger, foot, anything else, ears, eyes. You need to resolve that infection. So for people who have infected teeth, get your dentures. Don't even think twice about it. And hopefully a well-made set of dentures is going to get the trick done. And if not, you just have to come up with money to go with the next options. So that's my opinion on dentures. They're great value for the cost and they work for a lot of people. Guys, if you have any questions, put them in the comments below. I'll be glad to answer them. Otherwise, I hope this video was helpful. And be sure to check out my other videos relating to different types of dentures and dental implants if that's something you're interested in. I have a video that tells you your 5 options if you're toothless. I'll also put that in the description below so you can understand exactly what your options are if you're going to become toothless. But one of them is a full denture, complete denture, which I discussed in this video. Guys, it was a pleasure. I'll see you guys on my next video.